Welcome to the PowerLifting Podcast, the podcast where we interview top experts, coaches, lifters, and interesting people involved in the sport of powerlifting. With your host, Robert King. Robert is an international lifter and coach. Ladies and gentlemen, the bar is loaded!
Three, two, one, and we're live. Dr. Michael Mash, how are you doing?
Good. How are you? Thanks for having me on, Rob.
It's a pleasure to have you on. For anybody just listening, I talked to Dr. Michael a few times. He's an expert basically in barbell training, barbell rehab. Very smart guy, knows a ton of stuff. And this being the PowerLifting Podcast, I thought it would be a perfect opportunity to share some of your knowledge and experience with people who love to lift heavy weights. How are you doing?
Yeah. Good. I'd love to talk shop about that. As you know, that is what I love, giving out information about how to basically lift weights with less pain, improve performance, all that fun stuff. So I'm excited to talk shop about all these this topic specifically.
Awesome. So basically, let's go back before we go forward. What got you into, what got you into what you're doing right now, and how did this happen? How did this progress? How did this take place?
Gotcha. Well, without going into too much detail, it started way back in high school, back when I started training for baseball. I was actually a baseball pitcher, like your stereotypical 130-pound, lanky, 6-foot guy who was looking to throw harder. And I came across an athletic trainer at my high school who was really interested in barbell lifting. So he wrote me a program, and I remember ever since my sophomore year when I was 15, and I did that first rack pull with 135 pounds from like the shins. I was like, this is kind of fun. So I ended up, over high school, I ended up falling in love with lifting itself. And I started just lifting for lifting versus lifting for pitching performance. So next thing you know, I was like trying to 1 rep max like a week before a start. And I just started falling in love with actually training just to train. So I wanted to, and it ended up there was a shoulder injury in there involved with the pitching career, and lifting helped it out a lot. So I wanted to give back and help others. I realized how powerful lifting and getting strong can help with overcoming injury, and I wanted to help others do that. So I took the route of physical therapy, and now we're here about 12 years later. So I'm pretty pumped. So I've had this vision since high school, and I'm starting to live through it. So it's pretty cool.
That's awesome, man. So let's go for a little bit and talk about what it is. Tell us a little bit about barbell rehab, and tell us what you do, where you are. And then if you want to kind of talk a little bit about the workshops, that would be great, because I found you basically through T Nation. I was going through some hip pain. I was going through some stuff, and my first thing is to start reaching out and finding the experts and doing that. So I actually found you basically through there. So maybe you can talk a little bit about barbell rehab and your workshops, and kind of what you do and what you're doing right now.
Yeah, I remember writing that article for T Nation. That was the first article I wrote. It was something about how to squat with hip pain.
Yeah.
And I remember because it was published the day of my wedding back in 2017. So I woke up that morning, and I was supposed to be super focused on, hey, it's my wedding. And then I see, oh, my T Nation article's up. So that was pretty neat. Yeah. So I started barbell rehab with the idea, and it's sort of merged over, there's sort of evolved over the last 3-4 years. I started with the idea that I'm going to promote this idea that everybody should lift barbells. And I don't care who you are, barbells are the way to go. So it was the idea of barbell rehab. I'm going to rehab people with barbells. That's awesome. And although I still do that, I don't do that for everybody. Over the past 3-4 years, it started to merge instead of helping or forcing the barbell on people, it's now I help people who lift barbells overcome pain. So I think the barbell is a super powerful tool to helping people increase strength. But as you know, it's not the only tool. So I got away from the whole force feed the barbell issue. And now I really specialize on, okay, I teach personal trainers, strength coaches, and rehab professionals how to modify these lifts for people to make it more tolerable.
That's awesome, man. Yeah, I think as a coach, I've gone through the whole like barbell is life kind of philosophy, it's just,
Yeah.
I think when you're kind of married to the barbell, you just always see the barbell. And like you, I think it's a great tool when used properly, but there's sometimes other tools that may work a little bit better. But one thing I liked about what you do is that you're kind of like always trying to get them back to the barbell or make the barbell kind of work, instead of just saying, a lot of times you'll see professionals to be like, no, don't do the barbell. That's going to, whatever else. Whereas, if we love the barbell, so like the sooner we can kind of like get back to using it as a tool and using it as a tool to help us rebuild, even better. You've been doing a lot of workshops recently too. I've noticed you've been a busy boy up until this whole,
Oh yeah.
coronavirus thing. Why don't you tell us a little bit about your workshops? Because I love seeing what you're doing with that.
Yeah. So it was this vision of, I'll give you the line I give everybody.
Yeah.
Help fitness and rehab professionals learn how to coach and modify the barbell lifts for people with pain or mobility limitations.
That's
See how you can just
man.
rolls off the tongue.
Oh, that's a great concept though. I love it.
Yeah, because it comes from this idea of, I did my first one in my hometown in Pittsburgh in September of last year. And since then, I think I've done 11 live workshops across the United States. I had the goal to do 20 live workshops in 2020, and I'm a little behind, but I'm still going to try and shoot for it in the second half of the year. But we'll see. Everything's still up in the air right now. But yeah, so it's super awesome to get a room full, and it's usually a 50-50 split of strength coach, personal trainer, and physical therapist, chiropractor, because I just feel like there's such a divide between, it's getting better, but there's such a divide between the rehab professionals and the strength coaches, because the coaches have this idea, well, rehab professionals don't know how to load. I don't want to send my client to this physical therapist down the road who's just going to give him clamshells and tell him his glutes are turned off, or give him some sort of low-level breathing exercises and tell him deadlifts are bad for him. So like there's this misconception that, well, rehab professionals underload, so strength coaches don't want to refer to them because they don't want to get their client lost in that. And then on the other end of the spectrum, rehab professionals are hesitant to send people to strength coaches after the client is done with rehab because, he's just a dumb strength coach who's going to just have them deadlift and we're going to blow their back out again. It's just this, I see this divide where with the workshop, I try and unite these two and say, look, you guys should be friends. Like, we're in the same business of promoting health and fitness and keeping people out of we should have this common enemy of keeping people out of unnecessary surgeries. Okay. So I promote this unification of, yes, I'm not trying to teach strength coaches how to do rehab, and I'm not implying that strength coaches should be doing the rehab, but I'm teaching them a little bit about it so that when they do get that client that has finished physical therapy and now needs a little bit of extra tender love and care, or they have somebody in the clinic who just has a little ache and it can be fixed by a simple modification, I'm giving them the tools for how to do that.
That's awesome, man. Yeah, there's definitely, different divisions of viewpoints when it comes to that and stuff like that. But, come the end of the day, I think we all want what's best for our client and for the athlete, which is for them to be able to, train as pain-free as possible and hopefully then get stronger as well. And, the more tools in the toolbox and the more knowledge you have with that to approach it, the better, right?
Yeah.
When it comes to injuries, being a barbell guy, and I've seen this, in my gym a lot and stuff, and I love the barbell. I absolutely, barbell is my best friend, but I think the barbell can basically catch up with you. I think it can definitely over time and through, training, even if it's proper training, I think the barbell can do some damage. I see a little cat in the background. See your little
is that where? Yeah.
That's awesome. My shepherd's just right there down below me. No joke. But yeah, what would you think are some of the common injuries you see that people who love the barbell or use the barbell, like what are some common issues that you probably see in your practice?
Gotcha. I want to preface it. I don't think the barbell in and of itself is dangerous. I think it's more or less that it's the powerlifting crew who are only doing squat, bench, dead, right? They're only doing barbell, right? There's no unilateral accessory work.
You're right there.
Yeah. So I don't want people to think that, oh boy, like don't do this because you'll wreck yourself. Don't do this, or do it smartly and you won't. Smartly is not even a word, but you know what I mean.
Yeah, I get it.
What was the initial question?
Well, what are the kind of like the common injuries you see that a lot of people using the barbell a lot?
Gotcha. Probably top 3 are going to be back pain with deadlifts, hip pain with squats, and shoulder pain with the bench press. Easily the big 3. As far as diagnoses that come with it, I try to stay away from that because I like to treat people based on how they move versus what diagnoses they have. Because, for example, let's say somebody tweaked their back doing a deadlift, and that's like super annoying because it usually happens on a warm-up set, right? It's not the 1 rep max. It's you're warming up at 40% and suddenly something doesn't feel right, and now you can barely walk for like a week. So what'll happen is these people will get into the medical model, and then they'll get an MRI, and it says I have a herniated disc, right? But there's no way to know if that back tweak caused the herniated disc or if that herniated disc has just been there for the last 4 or 5 years. So I try to stay away from diagnoses and correlating diagnoses to treatments, but I do generalize it as, okay, you have back pain. Your MRI may say this, it may say that, but regardless of what it says, we're still going to treat it the same. So those would be my top 3 that I see.
That's awesome, man. I remember one of the things that was a game changer for me when, and me and you were talking about Stu before we jumped on this podcast. One of the things that was a big game changer for me was when I met Stu, and basically Stu said, treat the symptoms, not the image.
Exactly.
And, it's a big thing. I've had it happen with me. I've had it happen with some of my athletes and stuff of that. When you go and get an MRI or a CT, and there's nothing wrong with getting that, but as soon as you do, it's almost like a stamp of certification of like, yeah, you're kind of fucked. You're kind of like, you've got a herniated disc or whatever. And like you said, that may have been there even before anything was going on. And, maybe the deadlift pushed it over the edge, or maybe it was going to happen anyway. But I think that, dealing with the person instead of just trying to bottle things into one thing is very, very important, and like, it's like you said, you have a categorization, and then you start kind of like drilling down and seeing what's going on. What do you think when it comes to people with barbell injuries? Let's talk squat and let's talk hip, because that's kind of like where I found you. And I think it's a great way to start things. What do you think are some of the issues of people getting hip pain when barbell squatting? Like, what are some of the causes? What are some of the issues? Like, I know it's hard to say because it's not the individual person, but what are some of the common things that you may see?
Gotcha. Probably 2 things. One is the client is not using a stance width and degree of toe out, which is optimal for their hip anatomy. So as I'm sure you know by now, I mean, there's people were born with different types of hip version. So that's the way like the femur is rotated on the actual inside the hip socket. So if you're looking from like the down view, if you're looking straight down, people can have anteverted hips, which means they're sort of rotated inwards, or they can have retroverted hips. And this sort of correlates with what kind of stance width and degree of toe out that feels most comfortable for this person. If you try and take somebody that's really retroverted and you try and force them into a toes forward squat, they're most likely going to get some sort of a anterior hip pinch at the bottom. And I think it stems from, I mean, there's certain camps, I'm not going to name names, there's still certain camps that promote everybody needs to squat with their toes forward, right? And that's the way it's supposed to be. But when you force these retroverted people into it, it doesn't feel that great. So I almost feel bad because some of these sessions I'll do, if somebody's had hip pain for years, and I assess their squat and they're squatting with a narrow stance, toes forward. And then all I have to do is say, well, why don't you widen your stance a bit and turn your toes out? And it's like this light bulb goes off. Oh, I've never tried that. And then suddenly it's like instantaneously pain-free. Now, it's not always that, it doesn't always work, especially if somebody's had it for a while. A stance modification is always my first go-to thing, but it doesn't always work. So I would say stance width and degree of toe out. The inability to find what works for you would be the primary reason somebody's having hip pain with squats.
That's awesome. I definitely encountered that from my own experiences and stuff, and I do it with my clients as well. And, playing around with toe position, playing around with stance, and just kind of like, how does that feel, and trying to read their body. And like you said, that simple little thing of opening up the toes and just changing the hip position a little bit can make a huge difference. What is your opinion on, let's say, squat depth? I mean, being a competitive powerlifter, we have to hit depth in competition.
Mhm.
I don't agree with doing it all the time in training, but what are your thoughts on let's say below parallel competition depth for safety and for doing it all the time?
Gotcha. Well, I think my thoughts on that have definitely evolved over the years. When I came out, everybody they come out like straight out of the gun. They're like, I know everything. So if you would have talked to me 4 years ago, I would have said a squat is only a squat if it's done to depth. Anything else is not called a squat, right?
Yep.
I would have just unanimously said that. I would have made fun of you. I would have commented on your Instagram video and trolled you and been like, what is this? This isn't a squat.
Ask the cats or nothing, right?
Exactly. Yeah. But I've since evolved. I mean, when it really comes down to it, I think the majority of healthy people with the correct stance width and degree of toe out, well, not correct, with the optimal stance degree of toe out for them, they're going to be able to squat to depth. Now, barring some sort of significant injury or past history, I don't think there's anything inherently wrong or dangerous with squatting to depth. And if it's comfortable, I think you can do it all the time. What it really comes down to is if you don't have the mobility to do it, and then you load up the bar to get down there. This is the clan where you do a bodyweight squat and it looks terrible, but you can't get to depth until there's 405 on the bar, right? You just need like more and more weight to push you down. This is where I think the issue comes, is if you consistently need to get up to like 315 or 405 just to reach depth, I would try and do something else other to not do that. But as far as if you can't get to depth, I still squat people, right? Because when it really comes down to this, is squatting 2 inches above depth like not working any muscles compared to like to depth? If you're just shy of depth, I mean, depth is an arbitrary term anyways for powerlifting standards anyways. Yeah, so it's sort of evolved over that. So I always squat people with the available range they have. And as long as it really comes down to more of the load prescription. Is the load, are you applying too much, too fast, too soon? That's where we're going to see more of the injuries.
That's awesome, man. Some really good points there, just about like trying to find as deep as that they can go that's within their range that's good for them right now,
Yep.
And over time you can improve that range, and many things that you can do to improve that depth if it is needed, but it's just finding that sweet spot of what's good at the time. One more thing on squats, and it's an article that actually you wrote for my Women Who Lift Weight site, is basically, let's talk for a second on squats and ankles. I never really paid much attention to ankle and feet until I started having to deal with hip problems. And my hip started to go bad, and I kind of realized that, okay, well, the hip is bad, but usually you got to go up and below. You got to kind of look around a bit. I started noticing how insanely tight my ankles and my toes were, and started working on them, and it did help my hip pain and help my squat a lot. And it's still something I work on all the time, is hip stuff and ankle stuff. It sucks, but it's so important.
Yeah.
What are your thoughts on ankles and toes, and how to improve them to be a better squatter and better lifter?
Gotcha. I think they're important. I don't think they're the end all be all, but they're definitely a piece of a puzzle. And I think it really has to come down to which is your squat variation of choice. Because each squat variation is going to require different amounts of ankle mobility. So take somebody, for example, that is a wide stance, toes out, low bar squatter. You can get away with that with very little ankle mobility. And that's usually one of the first squat variations I use for somebody rehabbing an ankle, because just you can go wide, turn the toes out, and then sit back. So that almost creates like a vertical tibia and little to no ankle dorsiflexion at all. So if that's the person's squat variation of choice, I might not look at the ankle too much, because I know that, hey, this variation doesn't require that much ankle mobility. But if somebody's more of a narrow stance squatter and does more of a high bar variation, in order to keep the barbell centered over the middle of the foot from the side view, which we're optimizing biomechanics here, that knee does need to translate forward, which does require a good bit of ankle dorsiflexion mobility. So in that case, that's where, hey, they don't have the required range of motion of the ankle to do the variation that they need to do. So we need to work on it. And I'm not a big advocate of just restoring mobility just for the sake of it. I'm an advocate of do you have the mobility to do what you want to do? If you do, you don't need mobility work. If you don't, then we need to work on it. So I'm big on the ankle, especially think of somebody that does like overhead squats, right? You need a lot of ankle mobility to do an overhead squat. So that's oftentimes in people that if they're doing an overhead squat and they don't have the ankle mobility to do it, I will take them out of that pattern, maybe train the low bar squat for a little bit, and then simultaneously work on ankle mobility so that they can do what they want to do. And then as far as the foot goes, I'll be honest, I don't look at the actual foot too much because there's not that much foot mobility required. If we're talking like foot as in like toes, or are we talking about foot as in like pronation, supination, or just in
Wherever
general?
you want to go with it. Yeah,
Gotcha.
wherever you want to go.
Yeah, so I'll be honest, I don't look too much at the foot itself when it comes to squatting because the foot's stable inside of a shoe.
Mm-hmm.
So I tend to zone more on the ankle joint than the foot itself.
Gotcha. Let's transition into deadlifts if you're okay with that.
Yeah.
I love me a good deadlift. Let's talk deadlift and back, okay? I've hurt my back a few times on deadlifts, one time really bad. Back pain deadlift's not fun. A lot of lifters at some point are probably going to encounter it. It's
Yep.
You can't avoid it. You can avoid it, but at some point it's probably gonna creep in there and stuff like that. What are some of the issues you see with lower back injuries and the deadlift?
Gotcha. Well, I think we can even extrapolate further. A lot of humans are going to experience it, whether you lift or not, right? 80% chance that I say the biggest risk factor for having low back pain at some point in your life is being human.
Yeah.
So,
yeah.
So I try and normalize it a little bit, right? A tweak here and there is going to be normal within normal human limits. But what the issue is are you tweaking yourself like twice a month, like every time you deadlift? Now that's an issue, right?
Mm-hmm.
So I've evolved on this thought. 4 or 5 years ago, I would have told you that the single biggest risk factor for having low back pain during the deadlift would have been rounding your back. And I've since gotten out of that idea. And it really comes down to are you putting a stress on your back that it's not adapted to? So I think it really, really comes down to the loading. I don't think rounded back deadlifts are inherently dangerous, but if you sit on the couch for a month and then go and try and pull a 1 rep max rounded back deadlift, you're probably asking for trouble. Mm-hmm. So I still coach. I mean, we could go into a whole debate on whether you should pull with whether neutral spine matters or not. I still coach to the coach's eye. I'd like to see a neutral lumbar spine. And I think the biggest risk factor for back pain during the deadlift is twofold. It's either going to be a load management error. Did you do too much, too fast, too soon that your body wasn't ready for? Or do you have some sort of psychosocial load management error? For example, we know that one of the biggest risk factors for low back pain is somebody's dissatisfaction with their job, right? Or stress, anxiety, depression, an inability to cope with life stressors. Mm-hmm. So if you have that going on and you try and 1 rep max deadlift, it's like a recipe for something to go wrong. So I'd like to treat low back pain as a whole. How is the person coping with certain life stressors? Do they have stress, anxiety, depression under control? Are they living a general healthy lifestyle? Sleep, diet, nutrition, all matters. And then also trying to avoid any kind of physical load management errors, making sure they're not doing too many sets above an RPE 9, making sure they're not taking their sets to failure every single time. So I think it's twofold there. So psychosocial and physical load management errors.
That's a really, really, really good point. And not looked at enough. I think, dealing with injuries, whether it's my own or working with my clients and stuff. And it's easy sometimes to say, I hurt my lower back, and then you drill down and look at the lower back. Okay.
Yeah.
But like, there's a lot of stuff going on, man. There's so many things, like you said, whether it's stress, emotion, anxiety, depression, job, there's a lot of things. And like, if somebody's unable to heal, if somebody's not in a good mental state, it's hard for their body to be in a good physical state.
Yep.
I've seen this happen. And again, my views are very similar to yours, which is, if you asked me a couple of years ago, I would have said this, and it's good to have an evolution of your
Mm-hmm.
thinking and your viewpoint. But man, I've seen that happen. I've seen people come in my gym and, sometimes they're they're just not there mentally, and then boom, they're out. You know, what's going on? It's like, oh, I'm going through some stuff. Okay.
Yeah.
Let's
And that's,
off a little, you know?
yeah. And that's why, I mean, RPE works great for that, because when people are going through some stuff, right, we know that the RPE of the set is naturally going to be higher, so that we can decrease the overall load on the bar so that they can still get a training effect despite not being in the greatest mental state. So it's not like, okay, I'm stressed out, I'm not going to train all week. It's, I'm stressed out. I realize that. I realize I'm having some trouble coping with life issues. Why don't I just back the intensity down a little bit?
Yeah, no, that's an excellent point, man. Like, love it. Let's kind of like focus in a little bit more on the deadlift. When you see like, let's say movement patterns, and we're talking like, you know, let's briefly touch on like the curved back thing. We don't have, like you said, you can talk about it for an hour. I'm sure we could probably do a full podcast just on like, you know, should your back curve at all? And there's a whole different thing of that. What is your thoughts on, you know, briefly curving of the back, whether you want to go upper, you know, lower, all of it? What, like, just touch on your thoughts on that for a little bit.
Gotcha. So I think the first thing would be to talk about neutral spine. And I don't have the exact study off the top of my tongue, but I know that Stu McGill was involved in it. And if what they found is, even to the coach's eye, if you and I look at somebody and we agree that is a neutral lumbar spine, there's still going to be around 20 degrees of lumbar flexion involved. So it's impossible, unless you're deadlifting in like hyper lower doses, hyperextension. A neutral spine to the coach's eye does involve some degree of flexion. So that's why I'm still going to cue neutral spine to the coach's eye, because I don't want somebody deadlifting into end range spinal flexion who's not prepared for it. So I used to be a movement perfectionist 5 years ago, where I wasn't loading anybody up until the entire spine looked to me neutral. If there was even thoracic rounding to my coach's eye, if there was lumbar rounding, I was like, don't do it. You're going to wreck yourself. Now I realize that you're probably not going to wreck yourself as long as the load is okay. I'm still going to optimize the movement pattern to the best of my ability. I'm still going to coach neutral spine, neutral lumbar spine. Mm-hmm. But I realize that, hey, as the load gets heavy, you're going to start to see thoracic rounding first, which is totally normal with a heavy deadlift. And then if you get really heavy, the lumbar spine is going to start to go into even more lumbar flexion to the coach's eye. I think it really comes down to the load. I don't think that the position of the back is the issue. I think you just shouldn't train any lift that heavy that frequently. So does that make sense? And the big picture is, yes, I'm still coaching biomechanics. I'm just trying to make sure that I'm not taking people to failure all the time.
Yeah, I think the internet deadlift police have a tendency too much of like, back's not flat, that's no good, you know? And it's like, there's got to be somebody who's a half decently smart coach with some experience knows that there's always going to be within reason a bit of wiggle room on that, especially if we're talking, you know, heavier loads, and especially then also on the platform. It doesn't always have to be completely perfect. I think most people will sometimes get too caught up with the fact of like, you know, like you said, your spine has to be perfectly neutral. Well, not everybody's going to be built like that as well. So it's kind of not always going to work in that way, you know? What are your thoughts on deadlifts and grip? Let's like kind of go in a different path with this. Are you a big fan of over under? Are you a big fan of mixed grip? Is there anything you prefer? Like, do you have anything in that regard that you like to go to?
Yeah. So, I mean, if I'm coaching somebody that's new to the deadlift, I'm going to coach a double overhand grip, just because that's the easiest. It's basic, and grip's not going to be the double overhand grip's not going to be the limiting factor, because they're not strong enough yet to like actually have their deadlift limited by a grip issue. So I always start people double overhand. Once we start progressing in intensity, progressing in load, and they start telling me, I feel like I could go heavier, but my grip's going to give out, right? So now we need to make a decision. I'm never going to let somebody's deadlift stall because of a grip issue. Mm-hmm. So the first question I'm going to ask them is, do you have any plans to compete as a powerlifter? Because as you know, there's only two grips that people are going to do in a powerlifting competition: under over or hook grip, if you hate your thumbs. But so at that point, if their goal is to compete in a powerlifting competition, I'm going to keep progressing them up either with a mixed grip or a hook grip, depending on what works best for them. Most of the time it's mixed grip, because hook grip, as you know, is really pretty uncomfortable in the beginning on that, on the thumb. But yeah, if you can get through it, eventually you can come out on the other side. So I'm not usually promoting that for beginners. I will switch them to under over. And one point I would like to make about under over is there's this misconception that, don't do an under overhand grip because it's going to cause some sort of muscle imbalance, right? Because you're supinated on the one hand and you're supinated at the one wrist and pronated at the other. So people will say, well, the supinated hand is going to cause external rotation at the shoulder, which puts that lat at a different line of pull than the pronated hand. And it's going to cause a muscle imbalance. There's no evidence to suggest this. I usually just tell people, you're going to know almost immediately which hand feels better under and which hand feels better over. That's what you're going to stick with. There's no need to consistently switch back and forth. If they're not competing, then I'll let them use wrist straps, because it's going to allow them to continue on the deadlift, progress without having grip be the limiting factor. That being said, I will still include some sort of grip training for that person as well, whether it be some sort of farmer's walks at the end, because I want the grip to still be trained somehow. So I will use straps. And even for the power lifter, I will let them use their straps on their back down sets. So I'll say, here, you're going to work up to your competition grip on whatever your top set is of the day, and then you can do these 3 sets of 3 back downs with straps. Awesome. So pretty much covers my thoughts on grip, I think.
That's great. No, actually, man, I think, it's, little things, and grip is not a little thing, but, kind of like putting the pieces of the puzzle together for where somebody is at that point of their training is very important. One last thing on the deadlift, core training and glute training. Let's talk core training and glute training. Is there any kind of exercises that you consider to be staples in core training and glute training? Is there anything that you like to do with your clients? Is it just very individual, or, anything along those lines?
Gotcha. I think it's pretty individual. I mean, depending on who you talk to, there's going to be really smart people in the industry that are going to tell you, well, you need to do isolation core work at the end in order to reduce risk of injury. And then there's going to be people on the other end of the spectrum who say, if you can deadlift 405, your core is not weak, so you don't need to do any accessory core work. I tend to be somewhere in the middle. And I think it really comes down to the client's goals. If they're asymptomatic, they're not having issues, they don't have any kind of physique goals where they're trying to hypertrophy their abs or anything like that, I'm not going to really include any kind of accessory core work. And I'm not going to give them the idea that if you don't do it, you're going to wreck yourself, because you don't want to put these ideas in people's brains. Like, you better do this or this will happen. So I usually don't program it in just because. But if somebody's having back issues, and depending on what kind of back issue it is, let's say it's somebody that has back pain with bending backwards. So for them, they may have this issue where they don't know how to properly tense their anterior core to prevent going backwards. So I will prescribe core exercises, anti-extension core exercises for that, whether it be some sort of hollow body hold, dead bug progressions, where I'm having them move different limbs while keeping that rib cage locked down on the pelvis. So that's a way just to show them, hey, look, this is how you can tense your abs and avoid going into a spinal position that hurts for you right now. So I will prescribe that for people in that situation. And then if the goal is hypertrophy, right, we know that the best way to hypertrophy a muscle is to take it through its range of motion. So I will prescribe flexion extension exercises for people if their goal is to hypertrophy the abs. Gotcha. 5 years ago, I would have said sit-ups are bad for you. Now I'm more of, okay, maybe doing 100 sit-ups after sitting on a couch for a month is bad for you. But if your goal is rectus abdominis hypertrophy, you might want to try and dose those in a little bit.
Gotcha. That's a great point. I'm very much in the same boat as you, man. I think that your mind and your training and your philosophies have to be changing and have to be kind of flowing and evolving. And if you're stuck in the one mindset, then it's not a good thing. Like years ago, I was doing countless sit-ups. There was so many sit-ups. And I think then sitting all day long, and then I go to the gym and I would do sit-up after sit-up after sit-up, and my back didn't like it. It's not that sit-ups were bad. It's just that sit-ups weren't good for what I was doing at that time, you know?
Yep.
Before we get into bench press, one thing I really like that you said about basically of pulling the ribs down and like bracing and locking in the core. What are some of the cues that you like to use when you teach bracing, whether it be the squat or the deadlift or both? Let's talk bracing. Let's talk locking the core, locking down. What are some of the things you look for and that you like to teach and cue?
Gotcha. I try and keep it as simple as possible so I don't give too many cues in the beginning. The first cue and the only cue I'm going to give to somebody that's new is take a big breath and hold it. That's it. That's it. Now, if I start to see that they take a big breath and they hold it, but on the descent of it, they start to overextend a bit. So it's all about taking that big breath, holding it, and then whatever position that your entire core gets in, that's what should stay stable. Not stable is not the best word. That should stay the same. It should look the same throughout the entire rep. Mm-hmm. So the problem is these people are bracing, they're taking a big breath and holding it, but as soon as they descend into the squat, now they're starting to lose that. They're trying to overextend, and then on the way up, they get out of it and flex again. Okay. So it's more or less of I coach a big breath, hold it, and if that is enough to make sure that their core stays in the same position the whole rep, then I stop it there. If I see that, hey, that somebody comes in, they're like, I'm having back pain, and then I look at their squat, they're bracing, but then as they descend, they're overextending, that's when I'll start to dose in that cue of, okay, here's the distance between the bottom of your rib cage and the top of your pelvis. I want you to pretend that distance cannot change at all throughout the entire rep. And then that's where that starts to come in. So I think it really comes down to only giving the cues that are necessary. So I'm not going to give somebody a big lecture on, here's the distance of your rib cage on your pelvis, yada, 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 if a big breath is enough to just solve that.
That's awesome, man. I've seen, I don't know if it's a trend in like strength coaching and like powerlifting, but I've seen the trend of like what I call over cueing. So a lifter's going to go lift and they're hearing like 8 different cues, and it's like big breath, brace hard, ribs down. And it's like, just keep it simple, right? That you got big weight on your back, or, you don't want to be thinking too many things. So the more you can simplify something, which is why I like why you said what you just did, the more you can simplify something and not change it if it doesn't need to be changed.
Yep.
Like keep it simple always, right? Let's talk bench press.
Okay.
Let's talk bench press. What are some of the common injuries that you see when helping people with bench pressing?
Number one is going to be the shoulder. I mean, there's already an idea around that you shouldn't even bench press because it's bad for your shoulders, right? The shoulder shredder, that you should just dumbbell bench press for the rest of your life. Yeah. I mean, if that's your goal, if you don't want a barbell bench press and you want a dumbbell bench press for the rest of your life, I'm fine with that. Again, 3-4 years ago, I would have said, no, that's not good enough. You need to get back to the barbell bench press. But if that's not the client's goal, that's not the client's goal. Mm-hmm. But for people who do want to bench press, I think the biggest issue you're going to see is shoulder pain. And you can draw an analogy between grip width on the barbell to stance width on the squat. And I think shoulder pain can arise on the bench press primarily due to 2 things. One, a load management error. I feel like that's my cop-out answer for everything.
Oh, no, but if that's the thing, and that's the thing, if it's right, without a doubt.
Yeah, load management error, or not using an optimal grip width for your specific body type. So some people are going to naturally feel better in the shoulders with a wider grip, and some people are going to feel better in the shoulders with a narrow grip. One's not right and one's not wrong. There's this like unanimous cue that people will say, oh, bench press hurts your shoulders, narrow your grip in, right? We've all heard it. Your grip's too wide grip's bad for your shoulders, move it in some. But in fact, what you'll see is in people that have anterior shoulder pain, specifically like that feeling of, oh, it's like a knife going right in the front of my shoulder. This is either like a subacromial pain syndrome, a biceps tendinopathy, a bursitis. Narrowing the grip for these folks actually can make it worse. Because what they'll tell you is you'll start to get this cue as a coach, you'll start to get this report from your client as a coach that, yeah, bench press hurts the front of my shoulder and I don't feel my chest working. It just feels like the front of my shoulder's working. narrowing the grip is going to make them even feel it more in the front of their shoulder. A lot of times taking that grip without getting them into a wider grip, more shoulder abduction, suddenly these people that tell you, oh, I have pain in the front of my shoulder, they'll start to tell you, I actually feel it more across my chest now. So that was one, like a big aha moment where I stopped, just narrow the grip. Wide grip's bad for your shoulder. Now there's a lot of times where I actually widen people's grips, and this will allow them to sort of get a different perception of the bench press where they'll start to feel it in their chest more versus the front of the shoulder.
That's awesome, man. It's so like comparing it, let's say, to a hip. I mean, coming from like powerlifting and having lots of experience in that, like there's always this thing of like, to maximize the rules, obviously, go wider, move your hands out closer to that ring, try to get your hands out closer to that ring.
Mm-hmm.
But for everybody, that's not always a great option. If you take somebody, like you said, like if their shoulders don't like that going out wider, then by going wider is not always necessarily going to be a better thing for strength or for, preventing injuries. Yep. Is there anything like when you work with somebody, do you have like a general guideline? Like, let's say you look at somebody, like I consider myself to be like a block. Okay. Like I don't have wide shoulders.
Neither do I.
Yeah. So like, when you work with people, do you see any kind of like common things of like people with wide shoulders versus narrow shoulders? Is there anything that you kind of like have seen that like, maybe somebody with a closer grip if they're this way, or a wider grip if it's this way, or is it very individual to the person?
Not really, to be honest. I think it's pretty individual to the person. I have not correlated like narrow shoulders with like a more narrow people with narrow shoulders do better with narrow grip. People with wider shoulders do wider grip. I have not seen that. I think it really comes down to just like some people can squat really, really heavy with a narrow stance, and some people can squat really, really heavy with a wide stance. I think it really comes down to I think you should try both variations and see what works best. Just like the whole sumo versus conventional debate. Yeah. I think people should run a cycle of both, see what feels best, and then whatever feels best is going to be your primary lift, and whatever doesn't feel whatever you're not as good at is going to be your supplemental lift. Awesome. So I really don't see a correlation between body type and grip width, but I think it's really individual.
What about, so we say shoulder will be the common injury with bench pressing. What are some of the things that you think most people, it's a pretty general question, but like what are some of the things you think most people could do in their training to prevent shoulder problems or to kind of like avoid them? Let's say we're bench pressing 3 days a week, different types of bench pressing. It's a lot of pressing work. What should we be doing to offset that or to kind of like counteract that to keep the shoulders healthy? Gotcha.
First and foremost, I think you need to make sure that the dose is optimized. So no amount of mobility work, horizontal rowing, vertical rowing, reverse flies are going to help if you're consistently training at like an RPE 9.0 or above. So the first thing I'm always going to look at is somebody comes in, they say, I have shoulder pain during the bench press. I say, let me see your program. What have you done the last month? And if I see that, oh, you're bench pressing 3 times a week, whether it be, I don't know, a bench press on day 1, a floor press on day 2, and a board press on day 3, regardless, you're doing some sort of horizontal pressing on 3 days a week. The first thing I'm going to look at is the intensity too much. And if it is, I'm going to bring it down a bit. I think it comes from this idea of like the Arnold era where you're only going to get stronger if you go to failure, and like all the magic happens in those last 2 reps. Yeah. Maybe if the goal is hypertrophy, but I'm not a hypertrophy expert, so I don't want to speak on that. Yeah. I know from a injury standpoint, I want to bring that down a bit. So that's going to be the first thing if my goal is how to reduce risk of shoulder injury. The second thing is going to be balance. I want to make sure that there is an appropriate amount of horizontal rowing variation. And the big thing is some sort of overhead pressing pattern. The overhead press is like demonized by some people as like the shoulder shredder. But if I look at a program, let's say somebody has shoulder pain with the bench press, their intensity's dialed in, so they're not making a load management error. But then I don't see any kind of pushing variation where the scapula are allowed to move around the rib cage, whether it be like a push-up, a pike, a landmine, some sort of overhead press. I want to dose that in. because I think the problem comes down to when you're doing a bench press, the scapula are stuck in retraction.
Great point.
And there's nothing wrong with that.
Yeah.
That's what's needed to do the bench press.
Yeah.
But we should also train pressing patterns that allow them to move.
Yeah.
So I will maybe, if somebody is doing a horizontal bench press variation 3 days a week, but no kind of variation that allows the scapula to move, I might decrease the horizontal benching frequency to 2 times a week. And then that third time, have them do some sort of landmine press, push up, or overhead press.
That's a great point. So speaking from my own experiences, I've been dealing with like I got a busted up elbow, and I've been dealing now with it's kind of like progressed into the shoulder. Okay. So benching has not been fun for me. I can bench, but oh boy, it's just not fun. But anyway, I just started feeling like my shoulder was just kind of like just locked up all the time. Okay. And one thing I haven't done in a long time because of my elbow is push-ups. And now my training partner, Rebecca, she got on this push-up kick, and I was like, well, you're doing push-ups. I'm going to not let you do more push-ups than me. I haven't done push-ups in a while. So I started doing more push-ups. And at first they were agony, and then kind of like started getting a bit better. And then I noticed just one day, and I was doing push-ups, I was like, my shoulder doesn't hurt. Like, my elbow still hurts, but my shoulder doesn't hurt the way it was. And then hearing you say that about movement to the scapula, because if I was just benching all the time, not really getting much movement on that. Oh yeah, all day, every day, right? Bench day every day, and it's the same position. But like you said, moving the scapula and adding in those type of variations are really good for overall for shoulder health.
Yep.
That's excellent, man. That makes more sense to me now. What about, would you say, changing positions of the wrist while pressing? So let's say with a barbell, we're always in that semi-straight. Mm-hmm. You can modify it a little bit, but the hand and the wrist is going to almost always be in that position. What are your thoughts on other pressing variations, whether it be like, neutral grip?
I gotcha.
Do you think there's any benefits to varying your grip and varying your pressing training?
I got you. Yeah. So with like any kind of barbell press, your hand's going to be in that fixed shoulder pronation or shoulder internal rotation, wrist pronated position.
Yep.
I think that if you're tolerating it well and there's no issues, then I'm not going to mess with it. Mm-hmm. I don't think that if you're only doing pronated position work and you're not having issues, that it's going to lead to issues. But if you're having issues already and all you're doing is a fixed barbell presses, yes, you might want to try different, and the dumbbells work great for this because, right, when you have a dumbbell, you can select literally any wrist position you want. Mm-hmm. And the simple change of just slightly rotating the wrists outwards, which is going to get the wrist out of pronation, encourage more external rotation at the shoulder. That can be the difference between a painful lift and a pain-free lift, just that little rotation of the wrist. Yeah, I will. That's one of the, you're actually going down my like hierarchy of things I would change if somebody has pain with the shoulder. Like the first thing is I'm going to look at the dose. Is the dose? And then if it is, and they're still having issues, the next thing I'm going to look at is the grip width. Do we need to change the grip width? And if they're still having issues, the next thing I'm going to look at is, okay, can we find a variation that maybe opens those shoulders up a little bit by rotating the wrist outwards? So yeah, I do like doing that. It can be night and day difference.
That's awesome. What about, let's say, to improve benching and keep benching going well, what about, let's say, upper back work? Are you big into like row variations, pulling variations? Is there anything that like you kind of like have like go-to exercises, or is it again like all depending on the situation?
Gotcha. Yeah, so I will say I'm more of a rehab guy, and I don't have the best bench press in the world. So if you're looking,
some of the best people with the best knowledge of bench press in the world don't necessarily have to have great bench presses. And this is what I think that goes wrong with the sport sometimes. Is I've talked to people at the highest level that were like incredibly smart and incredibly strong, and I talk to other people that are they're strong, but they don't really know why they're strong. Some of them are just strong. I think knowledge is important to that puzzle. Do you use the barbell much for rowing, or do you have any other tools that you would like to use when it comes to rowing? Like
for rowing, yeah. So I think if the goal is to increase the bench press, everybody, I think the general idea is people will be like, well, since you have to press the shoulder blades a lot, you got to do lats. And I think they're missing the boat on that, because when it really comes down to it, it's not more of the lats that are stabilizing the shoulder. during a raw bench press, sure, it's different.
Mm-hmm.
It's more of the scapular retractors. So I'm looking for those horizontal row variations over pull down, pull up variations if the goal is to make somebody feel more stable and improve bench press numbers. So I really like the dumbbell row. I like the seated row. As far as like a barbell row or a pendlay row, I think that really comes down to the person specifically. If anybody has any kind of fear avoidance, meaning they're nervous about it because I don't want to hurt my back for deadlifts. Like I don't want to pre-fatigue my lumbar spine by doing barbell rows. I might shy away from them in those certain populations, but I think it's really, I think the barbell row, the pendlay row are really good accessory exercises to build the upper back. So I mean, in general, to answer your question, I think the rowing variations are key over the pull down variations.
Awesome, man. That's a good point. Okay, let's take things a little differently. You've coached a mixture of men and women. What do you see as, this is important to me because I coach a lot of women, and with my women who lift weights site and everything, it's always kind of, do you see any big differences in terms of, let's say, injuries of coaching guys versus girls? Like, do you see, if you work with so many people, do you see that more guys have back injuries versus women because guys have bigger egos and just try to move weight versus women being a bit more technical? You know, like I've seen like some things in my work that I've seen with women and stuff versus men. Is there anything that kind of like, you know, you're coaching women versus guys? Is there anything that really kind of like jumps out at you from a lifting perspective with that?
Nothing. Like, I think the point you touched on of men making more load management errors, going too much, too fast, too soon, trying to max out more than women do. I might see that a little bit, but not enough for me to be confident in saying that happens definitely more in men than females. One thing I have noticed is that females tend to do better at higher intensities for longer periods of time without burning out as much that men would. So I don't know the study off by hand that shows that there's that correlation, but I just know from my experience, women do tend to tolerate higher intensities than men.
I think it's like, I'm not a science guy. I've, you know, probably read like maybe half a study in my life. I think it's important to talk to people and then, you know, see what they see without, you know, like you said about the women are able to just seem to train at a higher percentage and recover faster.
Mm-hmm.
You put a guy over 90% and he's going to need some time, whereas a woman over 90% has the ability to generate and recover much faster. You know, I never knew anything about this stuff until I was coaching girls for just like, wow, okay, you know, you shouldn't take your next rep. Okay, what, you want to try it? Yeah, okay, and they go.
Yeah,
you know, like it's very, very interesting to see some of those differences, you know. What's next for you? So with everything going on coronavirus now, you're kind of locked down, hoping to finish up the end of the year pretty strong. You started a online course, which I signed up for. Thank you for that very much.
Ooh, yeah.
Why don't you talk about a little bit about the online course and kind of like what you're doing with that?
Yeah, for sure. So the online course is the same exact material as the on-site course. Going into 2020, like I said, my goal was to do 20 on-site workshops in 2020.
That's crazy.
And then boom, coronavirus hit. In January, I had the plan of getting my July workshop that I'm doing in Pittsburgh. I'm swinging back to my hometown. I was going to get the July workshop filmed and then package it into an online product for sale in like September. But things changed, and now that everything was canceled, and I know a lot of people are home and it's a prime opportunity to do some online learning, I called up the videographer, and we had right before like we got put on lockdown, I was like, we need to get down to the gym and we need to go through this entire thing. It's going to take an entire day and we're going to film it start to finish. So we were able to do that. I think it was 2 days. Yes, we went on lockdown Monday, and I filmed the entire workshop. No, it was 1 day. I filmed the entire workshop on Sunday, and then we were on lockdown Monday. So it was like perfect timing because now the videographer is on lockdown too, so he can stay at home, and he just cranked it out. Man, did he do a good job. Just cranked it out and edited it all. So now it's this online course. It's approved for CEUs through the NSCA, NASM, and for physical therapists, PT assistants in 28 different states. It's take at your own pace. It's about 6.5 hours of video content with some supplemental reading and a 20-point quiz at the end. But it's right through my website. And I always tell, if you're a strength coach or you're a personal trainer and you want to learn a little bit more about rehab, or you're a rehab professional and want to learn a little bit more about strength training, I might be biased, but I think it's the best course out there for you.
Awesome, man. No, the course is top notch. It's a big reason I reached out to you as well, because I just thought it was such a great concept and such a great idea. And, you know, I agree with you completely. Like, I think there's just no better feeling than just the barbell. And if you're not bitten by that bug, well, that's cool. Maybe someday you will, and maybe someday you won't. But I don't know, man. There's just something about that barbell that just feels damn good. Hey, like it's just,
agreed.
you know, my girlfriend, my training partner, Rebecca, she's been doing a ton of kettlebells. So we've been doing a lot of kettlebell stuff, and I've been teaching and working with her, doing a lot of that. And she took a little break from the barbell. And then the other day she was squatting, and it wasn't even heavy, and she racked it, and she was like, fuck, the barbell feels good, you know? And it's just a
like
great
that
feeling,
mental benefit too, right?
Oh, without a doubt, man. Like, I can do all the kettlebell training, and I love the kettlebell. I love dumbbells, all these things, but like nothing leaves me kind of like as physically and mentally satisfied as just a good barbell session. Just that, it's just different, you know? It's just such a good feeling, you know? And if you teach somebody who's hurt and unable to do that, to even just ease them back into any type of barbell training is such an accomplishment and such a good feeling.
Yep, for
You
sure.
know? And that's kind of
100%.
like what you're doing, and bridging both is fantastic, right? I love it. Is there anything you would like to add before we kind of finish up? I mean, I'm putting it on my calendar that I have to come to one of your workshops, and that's going to happen. And hopefully this whole coronavirus thing can, you know, fuck off, and we can kind of like go do our thing. But I would really much enjoy that. So kind of like, you know, anything you want to add, any points that you want to say before we kind of.
I mean, I guess the only thing is if you like what you listen to, feel free to follow me on Instagram, Facebook, and I just started a Whiteboard Wednesday YouTube series where I'm putting out 5 to 8 minute videos every Wednesday on different topics like this. So just trying to help as many people as I possibly can. So if you follow me on social media and share Barbell Rehab with any of your friends, colleagues, I would greatly appreciate it.
That's awesome, man. And I'll be sure basically to put all the relevant information and stuff in the show notes and stuff like that. This has been a pleasure, man. Thank you so much.
Yeah, thanks for having me on.
I look forward to hopefully at some point, maybe this year, you know, God willing and stuff, that we'll do things in person one day. We'll get a little workout in, maybe do a little chat and have some fun with it.
Sounds like a plan to me.
Awesome, man. Wish you all the best. Thank you so much.
Thanks for having me on.
Cheers, brother. Thank you for listening to the PowerLifting Podcast, and I hope that you enjoyed the show. If you did, please be sure to like, share, comment, and all of those wonderful things. If you want to find more information on the PowerLifting Podcast, you can check us out online at thepowerliftingpodcast.com. You can also find us on Instagram, YouTube, and all of those other wonderful media sources. If you have any suggestions for us on who you would like to see on the show, you can send us a message, or you can also email us at powerliftingpodcast@gmail.com. We look forward to hearing from you, and thank you for your support.